Dr. Saint Gandhi, and some of you may know me from some of my other content that I do in terms of creating videos and various other stuff to help GPs and practices and basically primary care understand all the tech and all the other things that come along, like PCNs and that kind of stuff. And the GPDF basically asked me to come and talk to you about how to be a little bit more productive, and in order to help with that, focusing specifically on System 1, because that's kind of my thing, and various other things that we're going to talk about as well that hopefully will make your working life that a little bit easier and stuff. So I'm going to bring up some slides. These are more just so I remember to talk about various different things, if that's okay, and we will get cracking on. I think we've got a couple more people jumping in. And this is going to be slightly interactive. I've got some quizzes and stuff, so we'll get to those in a second. But as we get started, some of you may have seen my lovely image I created a few months back about the actual amount of work we actually do in general practice. And as you can see, it's astronomical. It's a giant iceberg that will sink the Titanic and every other ship going. And you know, it's important that I think people understand the amount of significant work that we do out in general practice and stuff. That's me, where I work and stuff. So I work at Wellspring Surgery, where I'm currently coming live from, because I'm going to jump straight into an on-call session as soon as we finish this. I'm also a PCN clinical director as well for our local network. And that's my techie stuff that I do. So I run eGP Learning, which is a platform to help GPs use tech a bit more effectively, as well as the eGP Learning Podcast with my co-host Andy. And I'm on pretty much every social media platform going. I'm also an Innovate editor for their podcast. I run the System 1 Facebook users group, which many of you may have hopefully come across. And if not, we'll be running a conference later on this year in September as well. And also I'm a local LMC representative, and I'm an absolute geek. I love all these kind of things, board games, manga, Marvel, you name it. I love it. And I love creating images to try and help people understand things in order to, with those themes and stuff. But the plan for today is basically to cover this stuff. This is going to be a fairly information dense webinar, but hopefully, because it's being recorded, you'll be able to go back and watch various parts and stuff. And don't worry, you are going to get a sheet at the end of this, which has everything written down in a nice little format. So you can just print it off, keep it on the side, so you've got all those little hints and tips, so you don't have to worry about jotting it all down and that kind of stuff, and a variety of links to useful videos that hopefully will make your life a lot easier in practice. First thing I'm going to mention though is my guide to using System 1. So if you are relatively new to it, or if you want to kind of figure out how to do some of the basics and stuff a little bit more effectively, do go have a look at my 30-minute video that basically walks you through the basics of using System 1 as a clinician. It's a really good educational tool for new clinicians in your practice, and often I've had people comment that it's better than some of the training they get from System 1 teams and stuff as well. However, they are getting better at doing it. I think that's probably because they've been watching my video, to be honest. But I'm going to start off with some really basic kind of things that are going to help enhance the way that you work in general practice using a computer, first of all. And these are things that I would highly recommend everybody knows about first. And just before we get onto them, I'm going to ask you to sign on to something called a slide. Phone up to that QR code and use your camera on your phone to go to the web link, or alternately type that website. So ahaslides.com, GZL65, and the GZL are in capitals. And if you do that, it will take you to a website that hopefully we'll be able to do some really cool stuff with. So I'm just going to give you all a few minutes to do that. And I need to move this around. There we go. And as you join in, hopefully, I can see a couple of people jumping in there. You'll see our first question on there, which is the correct keyboard shortcut for locking your PC? So I put a few options there for you. If you could vote using the AHA Slides thing, just so that I can see whether or not you think it works or not. Hopefully you can all see that. If you can't, do let me know. Let's do that, and that should hopefully start it off. So yeah, got a few people dialed in. There we go. And let's get started, shall we? So first question, got 30 seconds, I believe. Which is the correct keyboard shortcut for locking your PC? So 15 seconds to go. 5, 4, 3, 2, 1. There we go, time's up. So we've got a couple of votes. So we've got Control and L voted for, and we've got Control Enter and Delete. Actually, the correct one is Windows button and L. And I think a lot of people sometimes get that confused with. So I wonder if the people who've gone for Control Enter and Delete are thinking Control Alt and Delete, which is true. Control Alt and Delete is a great way of locking your screen, but in order to do that, you have to press that and then press again something else to lock the screen. Whereas Windows plus L automatically locks it really quickly, and it's a really quick way of basically keeping your PC safe. Why is that important? Well, let's move on to the next bit. So there are a variety of shortcuts that I think every clinician should be using and know about. So most people know about Control and C and Control and P, which is your copy and your paste shortcuts for any kind of text or images or that kind of stuff. But have you heard of the copy and paste clipboard? No? Well, I definitely recommend giving it a try, and there's a reason for this. So if you press the Windows button, which is, in a lot of PCs nowadays, it's got the little Windows icon, more often than not, it just says Win on it, and V, that opens up what's called your copy clipboard. So that's where it stores the copy things that you've done. And the reason why that can be really useful, if you're copy and pasting certain things fairly commonly, so text or numbers or that kind of stuff when you're doing your referral work or various other kind of things, then it allows you to jump between the different things that you've copied, and it keeps that in the computer's memory bank. And you can even save some of those if you want to. So for example, if I was to bring up my copy clipboard and just check there's nothing on it that's patient identifiable, nope. So unfortunately, I can't bring it across onto the shared screen, annoyingly, because this is the problem behind two screens. But if you give it a try on your PC, you should see that it'll allow you to do that. And then you can select the ones that you want. And next to each one, there's 3 little dots on them. You can either delete things or you can pin it. And if you pin it, it will stay in your copy clipboard until you basically reset your computer. And that can be really useful for, like I said, common pieces of things you may want to copy. The reason for using this over potential other things that allow you to do that is because it's stored on the PC. IG-wise, it's safe. There are software, there's browser shortcuts and extensions and stuff that allow you to do this. But important to remember, they store things in other types of servers and things, and therefore, as a result of that, may mean that unfortunately, it's not safe from an IG perspective. Next up, quick delete. So have you ever sat there pressing backspace, 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 backspace and keep doing that? It's a really inefficient way of doing things. Even if you press and hold it down, it can still be waiting to delete considerable longer pieces of text. Really quick way of doing that is press Control and backspace and it'll delete the whole word in one tap. So actually you can delete paragraphs in a few seconds if you wanted to, and it's a really quick way of saving time. And I generally say if you're pressing backspace more than 3 times, then you should be using Control and backspace instead. You'd be surprised how much time it saves and things. To snap to your desktop on your computer. So if you've got loads of programs open, you just want to get to that one thing on your desktop really quickly, rather than having to minimize everything. If you press the Windows button and D, that takes you straight to your desktop. You can try that now. I'm not going to, because then it's going to make everything disappear on my screen. And one that's really good for multitasking is using snap screen. So putting one thing on one side and another thing on another, particularly if you've got the longer screens and stuff. And that's Windows and then the side arrow to whichever side you want to stick it onto, left and right. For those people that want fun things, if you want to use emojis, so Windows plus full stop will bring up the emoji browser. Important to know, unfortunately, System 1 doesn't allow you to use emojis. Really a shame on that. And then as you can see on there, the one it says not to do currently, because it's going to lock you out of the computer, and I'm not going to show you either, is Windows plus L, because this basically locks your screen. It's a really quick and sensible tool for IG people out there to lock your screen so you're not having to faff around and stuff. Fortunately, it doesn't work in reverse like the Control Alt and Delete one does. It doesn't let you go back into it. You do have to use Control Alt Delete to do it that way. But these are some really simple basic shortcuts I would really recommend all clinicians learn and use on a regular basis. So it will save you a little bit of time each time you use them, and that racks up. And that's hopefully what you're going to see throughout a lot of this and stuff. Next up, one of the most common things I hear people talk about is their frustrations having to wait for their computer to start up first thing in the mornings. When you switch it on and you're just literally waiting. Sometimes it can be a couple of minutes if you're really lucky. Average, I believe, is something like 10. I've heard some people talk about 20, 25 minutes they have to wait for your computer to boot up and things. Well, there are some things you can do to try and minimize that. And the first one I would really recommend you all do is switch off Teams. So Microsoft Teams is an amazing piece of software, but it automatically starts on most NHS computers. And unfortunately, that uses your computer resources. It uses the RAM, it uses the processor speed. And because it's doing that in the background, it's slowing down your PC. So switch it off. And if you want a video that shows you how to do that, bing, there you go. I'll send you the link to that as soon as we finish this video. And that's going to be coming out next week on the channel. In short, basically, you need to go to the startup window on the apps and just literally click switch off and stuff. And that will, I guarantee you, for those of you that have this on your computer, and particularly if you've got slightly older PCs, this is going to speed up the amount of time your computer takes to boot up and things. Okay. Next up, we're going to talk about some shortcuts in System 1. So I'm a massive fan of keyboard shortcuts. So you're going to get that flavor from today's session. And these are some really useful shortcuts I would recommend that you learn, because one of the things that we do know that navigating any form of computer system, that if you use keyboard shortcuts, you are generally faster than if you use a mouse, because you have that cognitive load of having to pick up the mouse, move it to the relevant section, element of finding the right bit you want to click on, because it's, it's never 100% accurate to snap straight to it, click, and then obviously moving on from there. Whereas keyboards, because of the muscle memory you develop when you use keyboards, actually you can do that so much more quicker and things. And here are some really useful ones to know about. So I'm just going to briefly mention some of my favorites. Here, there's loads more in System 1, but F1 takes you straight to the help screen. F8 takes you straight to the home screen, your clinician home screen and stuff. If you're in admin team, F9 is a great way for finding appointments, and F10 is for finding patients themselves. If you want to lock System 1, so you're just leaving and going off for your break and stuff, rather than having to find the lock button and doing it that way, if you're just going literally to the other side of the room, pressing F11 helps. And the two that I find really useful, because I'm a bit annoying when I try and do this, is Control and Q and Control, Shift and L. So these take you to the appointment views that you have. Now, depending on which appointment view you prefer, use the one that you like. I like the overview one, and that's the one that shows you the entire practice stuff in one screen. I'm a bit, megalomaniac in that way. Alternately, I know a majority of my team prefer the appointment ledger, which basically gives you that kind of view and stuff. And you can try this now. So if you've got System 1 open, give it a go. Try these shortcuts as we're talking and stuff and see what you think. If you want to close down System 1, one of the most satisfying keyboard shortcuts is Alt and F4. It just basically logs you out of System 1 completely. If you want to snap to your tasks, well, Control and T, and Control and Y takes you straight to your pathology inbox. A couple of other ones that are worth knowing about. So I'm going to show you this one in particular. So let's just get rid of that, because otherwise it's going to show you patient stuff. So this is a test patient I've got on my screen. So hopefully you can all see that from my System 1. And I'm just going to show you, if you go to the bottom left-hand corner and type in test, you can see it brings up this little tab at the top. Now you may, once you've used this the first time, it'll bring it up afterwards. At the top, but if you click on that, it takes you straight to the list of test patients in your practice. If you can't quite remember the names of your test patients and things, this is a way of seeing all the various different ones, particularly if you're trying something or looking at something that's relevant, for example, to particular genders, ages, that kind of stuff, then this is a great way of getting to it really quickly and effectively and stuff. Okay, just to show you some of the other ones we talked about, so let's go to the Control and Q. That's the overview I mentioned. Control, Shift and L. I don't like using this one, but there you go. I'm going to need to close that because I shouldn't be showing that. Apologies. Let's go back to the patient screen. There we go. So next up, we're going to talk about some of the other ones. So I'm not going to demonstrate this one. This is the Control, Shift and Enter. This is the panic button shortcut that you should be using if ever you're in difficulty. Now, it's slightly annoying that it's 3 keys. But however, it's 3 keys that are basically above each other. And I know what some clinicians have done, put little red sticker dots on their computer, keyboard and stuff that go up in ascending order, so that people know that if they have to click for a panic button, they just basically slam their hand and chop the keyboard, and that will press all 3 of them, hopefully at the same time. For free appointment search, it's Control and F9. And the one I use probably the most is Control and F10. That's finding people in the same household, particularly when you're doing things like safeguarding stuff or trying to find if somebody else's, others' information in the same household and stuff. That's a really useful way of doing it and things. So those are your kind of like more admin based shortcuts. If you want clinical ones, well, these are the ones that you can use in the patient record. Okay. So first up, I'm going to talk about time and date shortcuts. So to show you this, I'm going to demonstrate this on System 1. So I've got Bugs Bunny. Bugs Bunny's coming up to their review date. As you can see here, they're on amlodipine twice, bizarrely, and ramipril as well. So again, this is a test patient, just to remind you, this is not a real patient. Imagine if I wanted to advance Bugs Bunny's medication list. Well, I could individually select each one, move it on, and click and do things. So I could go like this, amend. Let's bring all my other screens. So there we go. And then I want to move the review date. So where are we? Let's use the review date instead, shall we? And I want to click on that, and we'll go 6 months. Actually, I want to decide I want to go 12 months or whatever, and click, and then do it that way. As you can see, there's loads of clicks that happen there. Well, a quick way of changing that is using the date shortcuts. So what you can do in any date field in System 1 is basically move it by either days, weeks, or months using the D for days, W for weeks, and M for months shortcuts. So say, for example, I wanted to move this particular one 2 weeks. So I can press 2 and W, and I'll advance it 2 weeks from the date that's already in the field. So that's now moved it to the 18th of January. But actually, I want to do it from 2 weeks from today, say, for example, because I want to make sure this patient comes in for their med review, for example. What you do is you press T to stand for today, 2 weeks. And as you can see, that's now moved it to 13th of July 2022, which is 2 weeks from today. Now, you may probably know this. That's fine. There are lots of people I come across who don't know about these really simple shortcuts. And the way I would do it for something like this is I would select all, press the lovely green arrow there, and then do exactly what I just said. So T, 2 weeks for all of them, and then synchronize. And there you go. I've done all my review dates in about 5 clicks. So much more time effective than doing it individually and advancing each one of those as we go along. Okay, I'm not going to advance that now, but that's the time and date shortcut. Next up, we're going to show you the add recall one. So back on the patient screen, simply by pressing F3, allow me to add a recall there for you, as you can see there. And you can add whatever recall you want from that point. After that, we're going to go to add reminder. So that's the similar shortcut. So it's Control on F3. By doing that, it opens the reminder thing. So these are the things that you see on the patient's home screen. So up here, these little reminders and things, you can add those directly, and that jumps to them and things. Okay. Other ones that you may want to consider, so adding a notification. So if you want to send a notification to the rest of your team, Control and E. Go into the visit screen really quickly, Control and H. If you want to save and close the record really quickly, F6. Those are hopefully some useful clinical shortcuts you can use, but it's important to know about other things as well. So one of my big tips is using something called the F12 Launcher. Okay, so what is the F12 Launcher? Well, I'll show you. So System 1, and you need an open patient to do this. And simply, on an open patient, you press F12, and you get this. It's called the F12 Launcher. And as you can see, mine's already populated with a variety of different things, templates, that kind of stuff that exist. And the reason for this is this allows you to snap to various different parts of System 1 with a couple of quick clicks. Again, I mentioned the keyboards are faster than the mouse. So locally, we have something called the F12 Toolkit, which is our Pathfinder, which is our basic way of managing referrals and things. So if I was to close that, I can go F12 and A, and that will automatically take me to the F12 Launcher referral pathway thing that we've got in our practice and stuff, and then I can navigate to wherever I need to from there. I can take that further. So if I press F12, you can see I've got particular different sections. So say, for example, I want to do my safeguarding, which is here. So I can press S for safeguarding. That'll take me straight to the safeguarding toolkit that we have within our local area that's based around that earlier one that you saw, but I don't have to navigate to it and stuff. And it's dead easy for me to then navigate to the specific parts of templates and stuff that I want to use from there. You can adjust this however you want. So by pressing F12, you can see there's this little search box here. You can search for anything you want. So I've put in path to search for the Pathfinder, click, hold, and then you add it to wherever you want. I'm not going to add that now because I've already got it there. But this is really useful way, particularly there's certain templates and stuff that you use on a regular basis. Really quick and easy way to make this so much more effective to navigate to. Other systems allow you to do this, so things like Ardens, some of you may have that in primary care, in your practice, or primary care IT are really good, cool things that allow you to do that. But yeah, I find the F12 Launcher a really sensible thing, and you can adapt this to whatever you find most effective for your clinical use. Coming up, so this has been talked about for quite a while, and this is what we call advanced access to notes, or prospective access to notes, or whatever you want to call it. This is basically patients being able to access their own information. Now, some places are already well ahead with this, but a majority of general practice hasn't pushed on with this. But one thing I would highly recommend having a look at is learning information about how to redact and also enable the patient access to these systems. It now has been pushed back a little bit further again to November. We'll see if it gets pushed back again. It may do, it may not do, but important to your team to be aware of this. So if you want some information on how to do that, there's a couple of videos there for you that will help with that as well. Next, I'm going to talk about some slightly more individual stuff, so how to change your user preferences in System 1. I've got a full video on that you can have a look at and walks you through these various different steps, but I'm going to pick on a couple that are really important from my perspective, I think, for you to have a look at and stuff, and these are probably the most useful ones that we've got. So to access this, you go to User, and then you click on User Preferences that you can see here, so it's about halfway down, and click on that, and then you've got various different user preferences that you can see. There are loads of different things you can change for your individual situation and stuff. One I would recommend is looking at your instant messages. So how long you want to postpone messages and stuff and things, and you can set that if you want to. You can go to notifications and change this from all notifications to urgent notifications. And what this means is that when somebody sends a notification, so you know those things are kind of like emails in System 1, instead of you getting a pop-up on your screen for every single notification that comes up, you can set this so that you only get a notification when you've got urgent ones. Okay, it just reduces the cognitive load and stuff for that. For clinicians, I'd recommend having a look at the pathology section and expand it to go to filing. Okay, and then you can change the default actions that you have. And the one I would recommend you consider, depends how you do things in practice, but immediately archive the report. Now, some practices use the archive functionality to help with their reception teams about informing patients about the results and stuff. We don't in our practice because it just fills up the home screen otherwise. So I automatically set that to archive and things. I have my default actions as normal and take no action, because that's when hopefully majority of my pathology results are going to go through and stuff and things. As you can see, there's additional things you can look at, but the next one I'm going to recommend that we do have a look at is scanning. Okay, so expand the scanning one, go to document processing. Again, this is a default action I recommend you adjust to. So it's either document management, which is near towards the bottom. Just check that that's on complete and not complete later, which is what some people tend to default to. The reason for doing that, and this is particularly when you've got new users, is complete later just means that it keeps staying in that box and they don't realize they haven't finished it, and they keep coming back and back and back and back and back and stuff. But set that to complete, that will make your life a little bit easier. Next, we're going to go to tasks, and a couple I would recommend having a look at. So these, every time you get a task, sometimes you're probably getting a pop-up and you're probably just clicking off it and thinking, I don't want to see this, I don't want to see this, I want to stop seeing this. Well, to change the way that they all show up, go to the receiving tasks and adjust the settings here. And then you can change whichever ones you want. Now, unfortunately, this one keeps adding new ones as time goes on. So even since I've changed last changes, you can see there's a couple of extra ones that now tick that I don't think were ticked. To be honest, I untick all of them, because generally speaking, I check my tasks a couple of times a day. I don't want pop-ups coming through. And from my perspective, there isn't really a task that should be urgent that I need to deal with, because if there is, then somebody should be knocking on my door or calling me, not sending me as a task and stuff. And that's how we run things in our practice. So, you know, deselecting a lot of them and stuff. Now, as you can see, they have added some new ones since the last time I've done that, which is why I've got some that are ticked still. But yeah, that's a really useful way of reducing that cognitive load of having pop-ups coming up all the time on your screen. Next is changing your default sending for tasks. And this is a really quick kind of safety tip from my perspective. So I have it default that all my tasks will be sent to me. And the reason why I have that is if I'm writing a task and I forget to send it to the right person, or I forget to change who I'm sending it to specifically, that can happen. At least it comes back to me and then I can just forward it on from there. It doesn't get lost somewhere in System 1, which particularly for new users can be a bit of an issue. So this is definitely a new user tip I would recommend that you set for all people and things. And last one, similar to the tasks one, so this is the warning section. So you can adjust the warnings that you want to have informed and you don't want to have informed and stuff when they ping up and things. It has a habit of rebooting this self, so you may need to reset that on times and stuff, but hopefully that'll be a really useful way for you to reduce some of the cognitive load you get from all these kind of alerts and all this other kind of stuff, and make the flow of your information a little bit more easier for you and stuff. Okay. The other thing that you can do from that screen is change your shortcuts in particular. And what I mean by this is color coding your system one, but also changing some of the task screen shortcuts. And I find these a really effective way to do things. So to show you what that means, so you can do this from the patient tree by right-clicking, and go to tree configuration and customize tree in particular. So if we click on, tree configuration is the correct one. As you can see, it's a bit annoying because you have to click in the right place. The other way you can do this, go to user and user preferences, go to patient record, and then go to tree colors and stuff. So here you can change the colors for the various different parts of the tree. So you can select one. Say, for example, you like using the tabs journal, or if you want to use the med3s. As you can see, I struggle to use some of these because I just find it hard to find them in the mass of stuff. So that's why I color code them, so it's easier for me to pick up and things. And I find that works really well for me. You can set these either in practice to the same thing, or you can set it individual to you, so you can highlight the things that you want highlighted that you want to use and stuff. However, the one I would really recommend you have a look at is the tree shortcuts. Okay, so a lot of people don't know about these, but these are ways you can snap to particular parts of the patient record when you've got an open patient really quickly, again using that keyboard function. So the one I find most useful for me is these two. So we've got a local EPACS, so this is our end of life care template and stuff. Getting to this sometimes can be a bit annoying, and it's not on the F12 thing. So the way I get to this is by adding it here, but the most useful one I found is this one, Control and 2, that I've set, which is getting to my tasks. And the reason why this is really important for me, and I'll explain why in a second. So you can set that, so assign a shortcut to something and add it on. Once you've done that, I'll show you what happens. So I'm in the patient record. If I want to go to tasks, so to see this patient-specific tasks, I would have to click on administrative. If you notice, there's a really small pause there. Now, depending on your systems, that can be half a second. That can sometimes be 3-4 seconds. Then I have to click down to go to tasks here. It will take me to the list of tasks for this particular patient, particularly those that have been filed, and I want to see historic stuff that's happened. Alternately, if I'm in the patient record, if I press Control and 2, which is my shortcut for tasks, it takes me straight to that section. And for some reason, it bypasses that brief pause that you saw that happened earlier. Now, bizarrely today, my system's working really well, and it's only like half a second. I've had days where that pause can be 3-4 seconds long, and that's really annoying when you just sat there. So this is a quick way of bypassing it, and I'd really recommend that you do that. If there's other parts of the records you struggle to get to, like I said, assigning a shortcut can be a really effective way of helping to make your life a little bit easier and stuff. So that's what we're talking about there, and relevant to the parts you want to go to and stuff. I'm going to talk now a little bit about hardware and stuff that might help to make your life easier. So if you've ever watched any of my content before, you'll know I'm a massive fan of having proper hardware kit to use. So for example, this is the keyboard I have in my practice. I don't use bog standard Dell ones because I don't like the feel, and these actually make me feel more comfortable, and therefore I type a lot quicker and stuff. And the reason that I don't have a number pad, for example, because I don't find I actually type numbers a lot on my keyboard. Okay, sometimes when you're doing medication dosing and stuff, but do I actually need a number pad for that? No. What I'd rather have the space for is something like this, which is a macro pad. So I'm just going to remove the cables and stuff. So this is a macro pad. There's various different things you can get that fit to do this. You can create your own using a tablet. You can use something like the Stream Deck by Elgato that can be coded to do this kind of stuff. Or you can buy one of these. So this is a KeyQuick device. Unfortunately, at the moment, KeyQuick don't let you buy individuals. You have to bulk buy them and stuff. So if you're buying for practices or networks and that kind of stuff. But basically, by pressing any one of these keys, it does some of those functions that I talked about. So, for example, I've got this one, which is my control and F10 to take me to some of the residents in the house. I've got this one, which is to add a reminder. I've got this one, which is to add a recall. I can just press one button, it does it straight for me. What's really fun is when you code these to do multiple things at the same time. So, for example, if I went to go to a fit note to set one for my patient, that's normally 3 clicks on system 1 to get to the relevant part. I can press this button. If I want to request an ICE pathology request, it's 6 clicks on my system to get to it, because I have to click here, go to the expand it, add new bit, click, move my mouse over to the top part, and then launch it. I can press this and it will do it. So it will send that request automatically, and it reduces the cognitive load, also reduces the number of clicks I have to do things with. Why is that important? Well, that's why planes have so many buttons. They have a button for doing one particular function because they know it makes life easier. It's more sensible, more effective when you've got specific button functions. And yes, I have one of those buttons that allows me to basically send an alert to everybody in the practice on my panic button instead of having to do the three thing, which is why I don't see the options and stuff on there. This also allows me to do loads of things with Zoom and Teams as well, which is the other reason why I love it. But yeah, really useful devices, and having macro keypads to make your life easier, so much better. Okay, if you're still in the AHA slides, I would love you to go back to that. I'm going to ask you a couple of quick question again. I can see there's one person in there, but that's the QR code to go to it. Or again, you can start typing the link. So ahaslides.com/GZL65, GZL are capitals. I'll take you straight to it. Alternatively, as I said, if you put your phone up to the screen with the QR code, it'll take you straight to it. And we're going to ask you a second question. And I'm going to ask you which of these you think is the most in terms of prioritizing your workload. So there we go. So how can you be more productive? I'm going to order those in whatever you think is the best order going. So you've got type faster, you've got standing desk, you've got smarter software, faster hardware, and multiple screens. So which of those 5 things in order do you think is the most effective, top to bottom, in terms of making your life quicker, easier, more productive, all that kind of stuff? So I've got one answer. So to go through the actual answers, here we are. So the first thing, the most productive way of improving your time in practice is learn to type faster, because it's the thing we do the most in practice. A lot of people think it's talking to patients, but actually we probably spend more time on our documentation and stuff. So speeding that up and actually speeding up your speed and accuracy with typing will reduce the amount of time you're spending in the clinical notes. And that's something that multiplies and compounds as time goes on, because actually the more you do it, the quicker you get and stuff. You can use dictation as an alternative option, and for some people that can be really effective, but learning to input the information into the patient record faster is one of the best ways of speeding up your abilities at work. Number 2 is using multiple screens. So there's, again, I keep talking about this concept of cognitive load. It's the time you spend doing something and that change over time that you have. And having multiple screens is proven to be more effective than having one large screen, or even one normal screen. Oh my gosh, please do not ever give me one normal screen and have to work from that. But having multiple screens allows you to multitask, and I hate that term, but do it so much more effectively, because you can look at 2 different things, 3 different things at once and manage that so much more effectively. Next is the input methods. So this is talking about the equipment that you're using and how you're putting that information in, and some simple tips, particularly when people are doing remote working. So have a decent keyboard, have a good mouse, have a good headset, have macro keyboards, those kind of things that help you put that information into the record so much more effectively. When we talk about smarter software, that can include other things like Ardens, primary care IT, those kind of software kind of hacks and stuff and things. But the one I would really recommend looking at is a password locker. And what these are programs or softwares that basically store all your passwords for you into a secure cloud environment. So these are generally as secure as the banks and that kind of stuff. But it means you don't have to worry about keeping all that information in your head about all those different passwords and criteria. And does it have to have 5 characters? Does it have to have 10 characters, with or without spaces, with or without capitalizations and all that kind of stuff? Actually stick it in a cloud-based password locker. And then when you need it, you can either use it through your computer, or if you want to, have it on your phone so you can access with your thumbprint, and then you can get that information easily and effectively. You don't have to worry about remembering it, especially when you go off on holiday and you've forgotten all your passwords. Has that ever happened to you? It has to me, and I guarantee you it happens to many of our colleagues out there. So best way of managing stress. And then standing desks. There's some evidence that shows it does allow clinicians to work more effectively because they're more mobile standing. And as you can see, I'm standing, in this presentation and stuff, because I think better when I'm standing, to be honest. But there is a little bit of evidence out there to show that that's effective as well. I talked about workflow, and workflow is really important and how you save time. So I'm just going to go on to a couple of topics that'll help you with that. But to help with your workflow in practice, do check out some of the content we've got. And these are videos and stuff that you can either share with people in your practice, or more importantly, sometimes with your patients. So some of you may have come across that lovely little one in the bottom left-hand corner, how to take a photo of your throat video. It's actually one of my highest ranking videos ever. Something like 180,000 views or something crazy like that. And that's because it basically improves the quality of the information you've got once you've shown patients how to do things. Alternately, you can use some of these other videos that we've created through our network, which is helping patients understand different aspects, like how to use their GP practice, how to get a prescription, how to register with the practice for non-English speaking. And some of these are in other languages. So currently we've got Kurdish and Tigrinya, as you can see on there. We're about to have Polish and Arabic coming up shortly as well. So these are resources you can share with patients to help them understand different aspects of, for example, a lot of our patients from abroad don't understand what a GP can do and why it's different to the hospital-based healthcare systems they've come from. And that creates a lot of conflict and challenges. So sharing that information in a language they can understand, yay, that should help, hopefully. And then automate yourself. So this is something I love talking about. And I'm not going to be able to show you the whole thing, because to do that in itself takes about 10 minutes or so. But this is a way that you can set up an automation within your practice for whatever you want to do. So using this video, and the link will come, as I said, later on, and do watch it, you can set it so that you can create any entry of text that will then automatically send a task to a group that you need automatically. So how do I use this? Well, I'll show you. Let's bring back Bugs Bunny. Okay. So I'm doing the medication review for Bugs Bunny. Okay, I've decided that actually this patient needs to come in for a review, and I'm more than happy for them to go see my pharmacist in practice. Okay, so what I can do is I can write some text. Well, I could write it, or I could use a preset. So I've got quick notes with various presets. So I'll go to my preset, and as you can see, I've got this one here, which is task sent to arrange medication review with pharmacist. Okay, so that's the action I've done. But what I've actually set up is an automation so that when I use that, I click select. Okay, that will put it in the notes, and click OK. And then that will send a task the moment I save the record automatically to our reception team to book this patient in for a medication review with the pharmacist. Absolutely, I could use things like Accurix or MJOG or that kind of stuff to send that to the information to the patient directly. But when I would typically use this, so our more elderly population who don't potentially have mobile phones, so I can't send it to them through their mobile phone, or if it's a non-English speaking patient where they may not get that message effectively and stuff, and I specifically want them to be called to book in. So, these are the situations you might want to use this. You can use this in follow-up, for example, if you want to book a patient in, if that's how you're doing things. And basically, to prove that this works, so at the moment, you can see there's no current outstanding tasks for this patient. I'm going to click Save. It's going to send it. Let's go back to Bugs Bunny now. And as you can see, there's now this task that's pinged up. And if we go to details, contact the patient and book for a routine pharmacist medication review, done. I've not created that task. That's happened in the background. It's automatic. You can set it so before you save the record, it brings up the task. So if you want to edit it, so I've got similar things for example, when I'm booking patients in for a phone review or a face-to-face review with me and I haven't set the time frame, and I can add that in. So I've got a template that comes up and things. I'm going to delete that so some of my reception staff don't get confused and start trying to call Bugs Bunny and to book them in for a review. And that is how you can use automation of tasks to make your life a little bit easier. This is how things like Ardens and Primary Care IT do a lot of the stuff in the background potentially to help you. Making this more personal to your individual practice needs and your individual situation can be a really effective way of saving yourself some time and stuff. I said at the start that I was going to give you a full page printout links and stuff to get all this kind of information. In order to access that, simple Word documents, got literally all the shortcuts I mentioned. It's also got some extra ones for various other systems like Zoom, MS Teams, really useful for your remote meetings and stuff. System 1 ones, you can print these off, stick them wherever you want, and all the links to the various different videos I've just mentioned in that talk, as well as some extra stuff, including, if you want to access it, I've had an offer from one of my colleagues, Dr. Ed Pooley, who does how to enhance productivity in your primary care. He's offering a discount to anybody who wants to join their course from this, as well as links to our System 1 update playlists and conference as well.